Welcome as everyone is coming in. Welcome. We're very excited to have you here today. We'll just give a minute for people to join. Oh, it's so exciting to see that participants number tick up. All right. I'm just going to get going with the intro, and then as people join, it, they can hear the intro. So welcome. We are so excited to have you. My name is Maddie Duke, and on behalf of ABA Technologies, I want to thank you for being here today. At ABA Technologies, we help companies who have specific performance problems by making sure that employees know what to do and by making sure that they do it. So in the context of today's webinar, we are specifically talking about RBT trainings. A little bit about our presenter today. Adam Hockman is the Senior Vice President of Learning Partnerships and Growth at ABA Technologies. As one of our instructional designers, Adam focuses on integrating innovative and educational technologies and instructional design methods into our expanding range of products. Adam plays a pivotal role in building learning and performance systems, as well as corporate training programs that enhance professional capabilities. His background includes valuable work developing educational technologies in private school settings and for pediatric cancer patients. Without any further delay, let's begin.
All right. Thank you, Maddie, and excited to see all of you here and looking forward to sharing this presentation with you. This is our second webinar related to the RBT 3.0 rollout. And this one zooms out a little bit. The last one that we did was about RBT 3.0 requirements by the BACB and how you might handle that. And this one is more general about as you're making those requirements, you're meeting those requirements, you're updating your training, there's some other things you can do to improve the effectiveness of the training, the efficiency of it. And so this is an adapted talk that I did at the Four Corners conference in April on common pitfalls that we see when people build and implement their RBT training. And this talk is focused on focused for behavior analysts who are designing training programs. So those are BCBAs who are in a training director role, they're in a clinical director, regional director role, or a chief clinical officer that's overseeing a training function. And we're mostly talking about clinical training, though we are going to be dipping into a little bit on how to get the other types of training in your organization to all line up, like systems training on things like Central Reach or Catalyst, as well as HR systems, any sort of HR or compliance programs that you have going on, getting that all streamlined. So I'm going to share my screen and get us started here. I will say that this presentation is probably much longer than an hour. Well, I know that's true. So I'm not going to make it through all of it. And we may do a part two if there's interest. But we'll give you a part one, and that'll have some things in here that might be useful to you. The thing I'm going to start with is some recent experiences I had where I put myself in the role as a learner, which is really important. And as I talk about these scenarios, I want you to think, when was the last time, if you're someone who is a training designer, if you oversee training, when was the last time you were really a novice in an area, in a trade skill like becoming an RBT? So last year, I decided I needed some new hobbies. I was looking down in my martini glass and I said, ooh, wouldn't that be nice if I knew how to make those? And so I thought I live in New York, so I was going to go to the American Bartender School and take a class on making craft cocktails. I thought it would be, really fun to learn to make these things that I was drinking, and I would have some fun with it. And when I went to the American Bartender School, they had a 5-day, 40-hour training to become a certified bartender. And I didn't really intend to do the full 40-hour training, but I ended up doing it. And it's perfect for this situation because we're all dealing with meeting 40 hours of training. And so I went in for this interview where I was met with this really passionate recruiter named Jeannie, and she was a New Yorker. She wore all pink, full pink suit. She had diamonds and silver around her neck that had martini glasses on them, and her nails were painted with martini glasses. And she had been a bartender for like 30 or 40 years before she started teaching. Her dad had been a bartender, her grandfather had been a bartender, and she was really passionate about trade schools and about bartending. And so in this group interview, she basically convinced us all to sign up for this 40-hour training. And I went to the class, these 5 days broken into 10 modules. Each module included different categories of drinks you would learn to make. So there was a cream drink category, martinis and Manhattans, highballs. And at the end of every module, you would take a competency test where you would demonstrate that you could make the drinks without breaking any glassware, which seems pretty easy, but actually, when you're going really quickly, everything's wet and slippery. And then at the end of the 10 modules, there was a written assessment where they gave you the name of the drink and lines where you put in all of the ingredients and the measurements. And then you had to take the real comp, which was making 12 drinks in 7 minutes. And that was very difficult. And I thought, I'm probably not going to pass. I'll have to come back and do it again. But I learned a lot I did pass, but I learned a lot in the process of participating in that training program. One thing that was really strong about the program was that it was practice focused. It was set up to simulate a real bar. They had disco lights so they could simulate a nightclub setting. They had you didn't actually use real liquor or any mixers. It was all food coloring in bottles so they could promote endless practice opportunities. They would do time practice, untimed practice. The lectures were quite overwhelming, a lot of information. These are some of the lecture slides, which you can just look at that one that's on screen, lesson 8, and think, oh my gosh, that's a lot for one slide. We practiced in simulations where we were making drinks in a nightclub, and then we had to go and do observation out in the wild, which is my favorite part, and then the practicum. So you got to drink, do observations, bring your field notes back. And this whole process of going to bartending school, I thought I had an entry repertoire that would help me like participate in this. I had less understanding and less of a learn to learn repertoire than I ever expected when I was in the moment. And it was there was a lot that I learned not only as myself as a learner, but also as a training developer. And so here's some of those lessons learned. One was the cognitive overload, just the amount of information that was being presented at once. There wasn't really distributed or cumulative practice that happened across the week. So as we went from module 1 to module 2 to module 3, there wasn't a whole lot of review of the material that had come before. When we broke out into essentially what were role plays, we were partnered up with other novices and we were expected to practice for the duration of the class and get feedback on it. But we didn't have a lot of face-to-face time with the trainer. So it was very easy for us to be making mistakes for 10, 15 minutes, and then realize, oh my gosh, we are not making this drink correctly. We've practiced the entire module wrong. And now what are we supposed to do about it? There was no concept instruction. And this is something that I'll talk about in just a little bit. But there was no concept of having us attend to what are the features that make this a Manhattan or a martini over another drink. And because of that, we were just basically doing this rote practice of making these recipes and trying to commit them to memory, which was very difficult. Another thing, as all trainers love, I'm doing it right now. This isn't a training, but I am telling a story right now. We as trainers and people who have experience in our professions and what we're training on usually have really good stories. And we want to share those stories because we think they'll be impactful. But not every story that we have from our experience needs to be shared with a group of novices. And sometimes the story can be useful, but it's presented at the wrong time and in the wrong way. And so it can just be overwhelming and it doesn't help them become competent or confident in what we're teaching them. And then finally, the written and competency assessment. There was not really any prep for this, except for that people made flashcards and crammed right before the assessments. And then they were pretty high stakes, stressful assessments. They had background music playing during the written exam, and then of course during the comp, they did the same because it was simulating a bar. And so all of these were lessons. Each one of these, as I was experiencing this, I kind of decided after day one, not really made for doing this professionally. I'll just enjoy this experience and I'll look for, as an instructional designer, as a trainer, I'm going to look for the lessons that are things that maybe I haven't picked up on in a really long time. I haven't, in the number of times that I've taught a lesson on reinforcement or I've trained on implementing discrete trials, maybe there are things that I'm doing, small things that are impacting the ability for the learners to learn. Maybe there are things I'm doing that are disrupting their learning journey and are causing issues early on. Maybe I've turned someone off from this field. Maybe I've turned someone off from working at this organization because of the way that I set up training, what I was saying and doing. I noticed some things about myself as a learner. I'm like, even through graduate school, I never walked out of a class or rolled my eyes at an instructor, but I did that a couple of times during this class, which was really kind of interesting. Like, what caused that? How did this environment, the way that the instructional arrangement was set up, promote, finally, just deciding that I was kind of done with it. So anyway, at the end of the training, I passed. I got my certificate. It was all great. I left. I can't recall probably half of those drinks that I learned to make. I know the basics and I can read a recipe and I can use the equipment and all of that. But if you were to expect me to go on the job and now you have expectations on me to perform at a certain level, and you're upset when that performance isn't at that level, that's where we will have some issues because I'm not masterful in any of these skills. I got a lot of practice. It was great. But because of some of these other kinds of barriers around the way that the training experience was set up, I am not walking out a master ready to go in and independently work as a bartender. So I decided, you know what, bartending, that was great. I'm going to do something a little less stressful. I'm going to take a sewing class. And so I went to the New York Sewing Center and took a sewing class that was focused on, it was supposed to be functional, like 101 sewing, where you learn the basics. And the first week we made a bag. And then the next week we cut out a pattern and made a pair of pants. And that was quite a big jump. Lesson one was learning how to make a bag. Lesson two was using a pattern and making a pair of pants for someone. So while it was project based and there was a really reinforcing work product on the end, that there was something that I could use, something that I could give somebody, it was an enormous leap. There was not a lot of focus on skill building. There was not a lot of focus on strengthening the component skills that would allow me to become better at sewing, knowing how to problem solve, and do some functional things like sew on a button, hem a pair of pants, add a zipper, fix a rip or a tear. Those are none of the things that I learned in 4 or 5 weeks of being in this sewing class. The other thing that was really difficult was that you had to be really persistent to get feedback from the trainer. The trainer sat up at a cutting table. There were all of these participants who were out here, were working on our projects. And if you wanted feedback, you had to go to them to get feedback. The once she did a demonstration at the beginning of the class, then the rest of the class was essentially a role play or do the exercise. And then you had to know at what points to check in with them. And so it's very possible that I know this was the case for myself, but other learners that were in the classroom, I could see that some of them had moved many steps ahead when they should have gone back and had a checkpoint with a trainer to verify that, yes, I've done that step correctly. Now you tell me what the next step's going to be, and so on and so forth. That because it all builds. And if you make a mistake early on and you cut this way and you're supposed to cut that way, well, the pants are ruined. So I made a pair of pants that don't really fit. They have an elastic band, and I gave them to someone, and it's something nice that they'll keep in their dresser. And so I have one more, I promise. And all of these are making points. And what I'm hoping I'm doing through telling you these three stories are that you think about the last time you were an absolute novice and think about what lessons you picked up from in doing that and how you've applied those to training. So I thought, you know what, sewing, it requires a lot of space. It requires a lot of skill, I think. And so maybe I'll go with crochet. So I took a 6-week crocheting class where I thought, okay, well, I can handle one stick and some yarn. And so it was a similar thing, the same kinds of things I experienced at bartending school, the same things I experienced in that sewing class, I was experiencing in this crochet class that was for 6 weeks, for 2 hours each session. There initially I'd gone through some YouTube videos about how to learn the basic crochet, how to start a chain and do your first loops, but I was stuck at a couple points and I got a lot of value out of the first class because I learned how to where I was going wrong, where I was sticking the needle and it needed to go somewhere, or sticking the hook and it needed to go somewhere else. But again, there was not a focus on building up skill over time. There was not a focus on component skill building. There was practice with some feedback, but after that, it was moving into more advanced areas of or applying all of these different stitches all together into a project. And so interspersed within that were a bunch of very funny, interesting, irrelevant stories that were not really connected to where I needed to be at this moment in time as a learner. And so what I didn't learn was here I'm showing him on my finger. That was my attempt at a circle. Everyone else made a circle, and for some reason, mine started going down instead of out. But I never learned to make a circle. I can make things that go in a line and make a square or make a rectangle. So I could make a scarf or I could make a very long strip into a blanket, but not really anything more advanced. And again, there was not close monitoring of my performance during the training. I would go up and show 30 minutes of work, but not really focus on, are you making the right stitch? Can I release you? Can I scaffold if you're not doing it? Can I provide some scaffolding that will support you in making the right stitches so that you can combine all of that together? All right. So I share those three stories with you because I can say that after working and doing a lot of training with RBTs for many years, these three most recent experiences where I was a complete novice really reshaped the way I think about a lot of things. Even just the way that I send out a reminder email or I provide them with a job support, a job aid of some kind. I'm always thinking about these kinds of things related to being a complete novice. So I encourage you to go and focus on learning a skill that you're not good at, feeling really uncomfortable with not being very good at it, looking for the kinds of psychological safety, as some people will call it, those indicators in the environment that it is a safe learning environment to make mistakes in, to grow and develop your skill. And then bring that back to the types of things you're doing when you're delivering training, when you're supervising technicians, when you're getting upset or frustrated that they aren't performing as you would like them to perform. All of those are factors that start up front with this 40-hour training. And so as you start to develop your training, you have to really be thinking about that. You have to put an eye toward not just, am I going to meet these task requirements by the BACB? Am I going to get them ready for the competency assessment? Or am I going to get them to read a protocol that's written in Central Reach? But am I actually building repertoires? Am I building repertoires that are going to be useful to them so that they can work effectively with this client, more clients, train the other technicians, and want to stay in this work? And so I pulled this definition of building repertoires from April Becker's one of her papers. And the thing I want to focus on is that shaping environment. Anytime you're training, you're supervising, you're arranging the shaping environment, which is acting upon the learner's current repertoire. And over time, if we can arrange an effective shaping environment, then we can develop skill in a way that's going to make people really be able to do the things we want them to do on the job. And so we're going to put some attention to focusing on developing repertoires, not just a bunch of skills, not just focused on a couple of behaviors that are really important, but developing repertoires. And there are a number of things that get in our way as we set up that shaping environment. So we're going to be looking at some of the pitfalls that get in the way of developing technician repertoires. And like I said at the start, I'm not going to make it through all of these. I might make it through maybe two or three of these. So we may do a part two to this webinar. But the focus is on these are some of the things that as we've gone out and done clinical discovery projects, as we've built custom training, as we've built in our RBT 3.0, these are the things that time and again happen with every clinic, every training program. And so we're going to dive into a couple of them. With each one, this is the way I've structured it. I'm going to describe what is the common issue that we see, where it is likely to occur, and why it might occur. And then we're going to talk about why it's a red flag. Why is it a problem that this is happening when we develop training programs and how to fix it? This is very focused on you as behavior analysts. I'm going to offer some resources that are out there in the behavior-based instructional design literature that you should pursue. But throughout each of these different pitfalls, if you'll look at the left side of the screen, you'll see each of those icons representing some of the information. And this is just a little, if you're looking for a quick tip to improve some of your instructor-led trainings as you're revising content, try to give learners a clear vision of where they are, a progress indicator. Where am I in this training? What are we doing? And one simple way to do that is to have progress bars that appear throughout presentations to visually help them track where they are. A lot of presentation decks we look at are quite a mess. They're slides thrown together that aren't cohesive. They don't tell a story. They don't connect concepts from one thing to the next. So you really have to look out for that because that can impact how overwhelmed a learner is, how effectively they can attend and engage, how they feel the progression of their skill and the story that's happening over the course of the training. So here we go with our first one. And again, we've got our blue lit up icon there to tell you what it is, then where it's likely to happen, why it's a red flag or why it's a problem, and how you can fix it. So the first one is not, we see a lot of organizations not defining the candidate and learner journey. Let's unpack that just a little bit. So, a candidate, when we talk about the journey for a user, the journey for a learner or a candidate, it's the experience, the step by step that they go through as they come into our organization. So, from the moment they find a job posting or they meet a recruiter at a job fair, learning about becoming a technician at Acme Behavioral Services, this begins their journey. And their journey continues all the way to being on the job, being supervised, their 30, 60, 90-day checkpoints, and so on. And oftentimes, the problem with the organizations have not defined the journey in a way that looks like a progression. There's no story or structure to how they're moving through this. So they may come in, they find that job posting, they go through a clinical interview, they get hired. Now they're about to start their training, and they're getting all of these different signals from different places. They're getting emails to get logged into SharePoint. They're being invited to HR training. They're going through the I-9. They are meeting with a clinical trainer. They're meeting with someone from HR, and they've been assigned modules online for training. Okay. All these things are being thrown at them, and they may be given a training schedule, but it's not sequenced in a way that's thinking about who they are as learners. What's their entry repertoire? What are their learning histories and preferences related to learning? So that's one place it happens is when we start throwing a lot of things at them at once. And then we compound that by adding disruptions. The first experience that a lot of learners have is that they can't get logged into their systems. They are not getting the password reset email. What is that like to start this journey at this organization? I can't even get logged into my account. And there have been learners where I've implemented training and it's day 3 and they still can't get logged into SharePoint or they can't get into Central Reach, where they haven't been able to log any of their hours. That's a very disruptive and confusing experience, especially when you don't know anything about the job at this point, or you know very little about the job. You're maybe concerned about what you've seen if you've gone out and had some early clinical experiences and you maybe saw a client, you observed a client in a toileting program, or you observed some challenging behavior that you've never seen before. Maybe you're worrying about those things and you're being distracted by all of these disruptions from poor planning of the entire journey or the entire experience. And we compound that even further by adding all of these different training events that don't really work in sequence with one another. And some of that is because we try to get an operational cadence. Every Tuesday from 12 to 2, that is when we're doing HR training. Okay. So that's a common thing that we hardwire in some training events. And, sorry you didn't get through all those modules on Monday, but we're going to go to this training on Tuesday and you're going to have to get caught up. So you already feel behind, and it's only day 2 of being on the job. And a lot of people that we bring into the technician role, as we know, may not have the learning histories, may not have the kind of resiliency repertoires to interact with those types of learning experiences. So we have to be really careful about that because the red flag is that we overwhelm them from the very beginning and they drop out. They don't even tell you they're not working at your organization anymore. They just don't show up the next day. Okay. Or as I've seen before, you're running a training. Everybody comes back from lunch except for a couple of people, and they've decided this is not for them. They are done. They've turned in their tablet. They are moving on. Okay. So it's very easy to overwhelm them. And then they begin attending to the irrelevant features of the training and the job requirements. The second piece is that it's one of the reasons why it's a problem is that we really miss the mark on their entry repertoire, preferences, and histories. This is an article that if you are designing training, you need to be familiar with. It's by Twyman et al. It describes the nonlinear instructional design process. It breaks down each of these boxes and it makes a distinction between how training designers generally approach training, which is in the same order as trainees go through the experience. And instead, it breaks down all of the components that we need to think through in terms of analyzing the content and skills that we're going to be teaching and practicing, identifying what are those performance objectives that we know that if they go through the instructional sequence, they should be able to do those things that we want them to do. How are we going to measure that to know whether or not they've met those, our criterion tests? How do we design criterion test experiences or simulations or competency assessments that are really going to capture the things that we know they need to be able to do? And then what are the skills, preferences, and histories they're coming in with? Learners are not blank slates. And if you treat them as such, you're going to miss the mark quite often. So you need to be thinking about how they're going to be perceiving content. That's one of the reasons why we design candidate personas. We know who we're hiring. So if we're hiring a bunch of college students, we know that their learning histories are going to be very different from mid-career professionals or people who've worked in healthcare or childcare before. And we need to adapt that instructional sequence. And just some of those small adjustments can really get people to anchor into what you want them to focus on, and you can move them through the training process. So the risk is that we don't account for those types of things. We really miss identifying who these people are that are going to be in our training and then designing a training that's mismatched from it. It can still be compliant. You can still design a 40-hour training that meets all the BACB requirements or any training for that matter, but it isn't relevant to the learners that are going through it. So now let's talk about ways to fix that. And I'm going to provide a couple of, if you were to search candidate persona, learner persona, client persona online, you'd find numerous resources out there on designing it. These are some examples I grabbed off of Google. I need to put the citation on here. But the candidate persona, many of you, probably your talent or HR teams, are going out, they're interviewing people, they're putting up job postings, they're looking at who's applying to jobs for the technician role. And then they're designing these personas, which describe that person that's coming to the organization. Okay. It describes kind of what their histories are. What are they looking for? Potentially, what are their motivations for finding the job? What do they want out of the job? What are their goals? What skills are they bringing in? And these are the ways that those talent teams really adjust their job postings, their interviews, what they say. They're very good at doing some of that. And it's really important that you anchor into that information. A lot of clinical organizations have their HR and interviewing separate from their training teams, their clinical training, and you have to meet up because all of if you're concerned about the training experience, it all begins with the candidates that you're bringing in the door. And you need to know who those people are because that's going to inform then your learner persona. And that's a description of telling us what are these people that we're going to be training? What do they bring to the table? What are their histories with training in general? What are their preferences for the ways that learning is delivered? Is it in bite-sized chunks? Is it in a classroom-based setting? Is it going to be in an online course? Are they accessing it from a computer or a phone? We've had there are many times where we realize, oh my gosh, a lot of our candidates who are coming in don't have an iPad. They don't have a computer. They are doing the entire 40-hour training on a cell phone, on a data plan, or they're going to a cafe and doing it. So those are all things that should be influencing the design of the training. But you have to know who the candidates are coming in the door so that you know what you need to do when you start that training program, when you start designing that training program. And you need to anchor it to the client populations that you're working with. And sometimes this we could say is a learner persona, but I'm going to say client persona, not to get it mixed up with our trainees. But our client persona or our use case is telling us what are the boundaries of the clients that we're going to be working with. This is an example from a project we worked on a couple of years ago, and we developed these. We worked with their clinical team to develop what are the three common characters or the three common clients that your technicians are likely to interact with. What's their VB map score? What's the curriculum look like? What kinds of programs are going to be written into central reach for them? What types of behavior protocols are written for them? That's the stimuli that they're going to contact. That's what they're going to have to be responding to and applying the wide array of behavior analytic skills to. We don't need to train everything that we could possibly cover. We don't need to cover the waterfront with people who are coming in for a 40-hour training. We have a finite amount of time. And if we really want it to be the most effective, provide as much practice as we can with the training program, then we need to really solidify what do they need to do on the job and map it to the kinds of learners they're going to be working with. So you anchor all of this, the candidate persona of the people that you're bringing in the door, that needs to be wrapped around. This is in a circle, not just a line. This is a circle that comes back around. It's iterative. You candidate journey. They're going to be working with this client population. Let's make sure they know what that means. What are the implications of working with that client population? What do we need to adjust about who we're looking for in this role? And then tie in the learner persona. And all of that will inform then your journey map or the journey of coming in through training. So as you come through our training program, you see those blue dots. This is the experience that the trainee's having. They're coming in the door. When they're out of training, they're going to be contacting their client. And the first thing that they need to do is they need to know how to look at the programming, look at the behavior plan, look at the info sheet about the client in their data collection platform. Then they're getting on the job and making sure that the client's approaching them, that they've built themselves as a reinforcer and so on. And not always is the sequence of the content that you're presenting structured in a way that follows that journey, which can make it very confusing when you then put people on the job in these unstructured clinical observations where you're sending them out to observe a technician working with a client and asking them to pick up a few things or to take IOA or to do a procedural fidelity checklist, all those types of things. Okay. So the candidate, learner, and client all work together to create the journey map. And at the same time, we're anchoring and thinking about what can they already do? What in all the different areas that we're going to be training, whether it's professionalism or ethics or clinical skills, what skills are they coming in with? What are their established repertoires? What are going to be the cost and benefits of them learning new behaviors that are going to be brought into that repertoire? And one of the best ways to think about that is through the framework Israel Gold Diamond developed, the constructional approach. This is this is the a reprint of the original 74 paper that he wrote on the constructional approach. But this way of thinking really helps us ensure that what we're designing is going to account for all of those different factors. That when we're developing training programs, when we're developing an instructional sequence, practice opportunities, on the job activities, and so on, that it's mapped onto those things. So the constructional approach really tells you a little bit more, digs a little bit more into the behavioral level of the learner persona. Okay. So that candidate and learner journey has to start up front because if you don't have that well established, you're just going to try to do a patchwork quilt which I would not be able to make based on my sewing and crochet experience. I could not make a patchwork quilt, but I do know that that's what you get when you take a little bit of, we're going to take these 5 modules, or my favorite thing that people do is they assign them the entire 40-hour training all online. You're going to go through 40 hours of modules. And then what we're going to do is we're going to add in some instructor-led training, some ILTs on top of it, where we're going to sort of teach you some things that are a little different than you learned in the e-learning. Oh, by the way, we're also going to have you go to this commercially available crisis management training where we're going to talk about crisis and behavior reduction and good behavior hygiene, but it's going to be a little different than you heard in the e-learning modules and a little different than the ILTs. And we're just going to kind of like stack them all on one another and hope you can figure it out. Okay. The problem is that a lot of people don't figure it out because they don't know what to attend to. And they, again, many of these people have never interacted with clients that you're going to be serving. They've also, some of them have never really interacted with children outside of their own children or nephews or nieces and that type of thing. So you have to be really cautious about that if that's the way that you're handling meeting compliance requirements. Yes, you have to meet compliance requirements, but it doesn't mean duct taping things on top of one another so that you can check the box. Okay. So I think that there's not enough going on at this very first box here to really address some of the issues that are coming up later on that people are really playing around with, like issues of burnout, performance problems, systems issues. They're not thinking about these experiences because if you really are thoughtful in developing candidate and learner journeys, and you're really evaluating who's coming in the door and what they're going to have to do, then you can really see whether or not what you're doing is aligned. If you took OBM, your is map and your should map, it's a little bit like that. Okay, here is what's happening, and this is what should be happening. All right, and so that we can get those to map up, and the candidate and learner journey is right in the middle of it. Okay, so that's a common pitfall. All right, now here's the second one: allowing new hires to observe behavior technicians with poor or inconsistent procedural fidelity. Okay. So there are a lot of times where we see in training schedules, people will be, a new hire will come in, they may do some, let's say they do 10 hours of online modules for the 40-hour training. They come to an ILT, and now we're going to have you start shadowing. Okay. And then as you're shadowing, then it becomes more with this, we've got these overlaps going where you're going to take on more responsibility and so on. And what ends up happening is that the way that the technician is paired with the experienced or the working technician is that they are often paired with people who have poor, inconsistent procedural fidelity on a variety of procedures they're implementing. Okay. And here's where we often see it. We see it when when you have a client and you've got a new hire and you're pretty sure that that new hire is going to be paired with this client. Okay. Because that client, we don't have anyone to work with them in the afternoon. We want to get the hours up. So we're going to pair that technician with that client. So naturally, you want that technician or that new hire to observe the client they're going to work with, which makes good sense. But at the same time, the client that they're going to work with, the technician that or technicians that are currently working with them have generally poor or inconsistent procedural fidelity. So they're watching a lot of what not to do, or they're getting what I'll talk about in a moment, the ghost system. They are getting a lot of information. They're getting inputs about how to adapt what's actually written in a protocol. Okay. So that's one place it happens. Another issue is we've got some of our experienced people that have been here 6 months, a year, longer. We've got tenured technicians on the job. And so when people need to go do clinical observation, we just immediately pair them with the tenured staff member, regardless of their procedural fidelity scores. Okay, they've been here long enough. We know they're going to keep the client safe. Maybe they work really well with the client. They know the routines. They know the systems. They know how to write session notes. They know how to submit everything on time. And yet, they don't have good procedural fidelity. Again, they're watching really bad models of implementing or focusing on a particular goal that you have for them. Another issue is where a technician has really great rapport with a client. They have really fun sessions. The client really likes to be around them. But the thing you want your new hire to observe is them effectively implementing programming. And on programming, that technician has poor procedural fidelity. So you have them watch it. And so you want them to pick up, you make the assumption that just because they have good rapport with the client, means that that's the right person to have them watch. Okay. Now, that doesn't mean that you don't have new hires watch people that have great rapport, but maybe aren't doing everything right in programming. It just means that when you put people on the job for those early clinical observations, that you need to give them what is the goal? What are you going to observe this technician do? Okay. And one of the things that's out of the LeBlanc, Sellers, and Ally supervision book is they talk about when they talk about mentors, they talk about that some of our mentors, there are things that they do that we want to emulate. They're great, they're good models, but there are also things that they do that we don't want to imitate. They're things that we want to avoid. Not every person is perfect. So there are certain characteristics or certain behaviors we want to model after, and there are others that we want to avoid. And that's a similar idea when you are short-staffed and when you don't have a lot of options of who people can observe, is that you pair them with people to observe certain tasks or certain categories of work that the technician's going to be doing. So I may have you observe John to look at how great he is when we do that pre-session pairing and he's doing some rapport building. Great. These are the three things I want you to focus on. I'm going to have you observe Jane on implementing discrete trials because she's really consistent. Her pacing is good. Her data collection's accurate. We have good IOA scores. Okay. Then they're seeing kind of the best of everything that you've got available to you. Now, they may not be able to observe everything that their client's going to be going through, their future client, if you've already got that paired up. But you can do that later in the shadowing sequence. Early on, you want people who are sturdy within those skill areas, and you want those to be the people that they are observing. Now, I know I'm saying this is like this is kind of a workaround, and it's like, okay, well, why don't we just fix procedural fidelity for the technicians that are working the job? But there are times where you, as a training developer, or you, as the clinician who's doing these pair ups, you don't really have any other options. So you're doing the best that you can to make these matches. And the best thing that you can do is try to find who to observe in those areas and strengthen the overall use of procedural fidelity across the organization. Now, some of the risks, the reasons why people cannot, you really don't want to have new hires only, observing the technician that's working with their future client who has poor procedural fidelity is because they will copy what they do. They don't know any better. So they're going to imitate, obviously, what someone more experienced is doing. Okay. And especially if you're in a clinic setting where you're kind of like in a bullpen where everybody can hear one another, you can hear technicians give similar types of cues or similar types of verbal praise. And then everybody starts doing it. Okay. There's a lot of observational learning that's going on. They start imitating what other people are doing. And that happens the moment that you put a new hire in the chair in one of those spaces where they start copying what they're seeing and what they're hearing from technicians that are on the job. The other thing that can happen is when people have poor procedural fidelity, or people are on the job and they're not doing, completing all of the tasks they need to complete and at the expected performance level, is that this ghost system develops. And this is a term I first heard from Dr. Karen Blasey when she was talking about implementation science, where she said that it's those performers that have learned to get around the bureaucracy in the organization. They've learned that not every the process is broken, the systems are broken, but here's how to get the work done anyway. They figure out all these workarounds and they don't really tell anybody. And so a lot of new hires, when they come into the job and what you've set up for them isn't working, they'll find workarounds. And many of the people who are working in that job have already found those workarounds and are going to share those with your new hires, which then begins to really misalign what you're saying in training and what's happening in practice. Because then what happens is there's this divide. The training department becomes this like resource hub that's like, we're going to show you a way of doing it. You're going to go out there in the wild, and people may not be doing it that way. Okay. And that's a big risk because that's where procedural fidelity starts to fall apart. Okay. It's the moment that what people see training as is the thing they have to get through. Okay. Not the thing that's helping them on the job. What they then look to are other people in the environment to tell them really how to get it done. They looked for the ghost system, they build their own ghost systems, and you continue getting this misalignment between what you're saying and doing in training and what's being said and done in practice. So, some ways around that is first get a handle on measuring procedural fidelity. And this is something that's kind of an interesting, I don't know where you sit in your organizations, but clients we've worked with, when we've done discoveries, it's like there are a continuum of procedural fidelity practices that are out there in the literature, and people are either on one end or the other end of the spectrum. It's like they do collect procedural fidelity data and use that information in training. Okay. And that's how they get people passed off their comps and then they get them on the job. And then they don't measure it consistently or ever. Or on the other end, they create these really sophisticated, detailed procedural fidelity checklists and they're scoring trial by trial data. They have all this data, they don't do anything with it, or they come up with a couple of comments, and these are the two targets that you're going to work on before I come and do the next observation. And the accuracy of those data are pretty low. And it's like these two different camps that are operating against one another. And it's the people who don't feel that they have any time to do any procedural data collection. They don't do it. Okay. But there are researchers out there and there are some publications out there about a variety of practices, comparing those different types of practices, where if you can't always have somebody who's going around and doing a daily 20-minute observation and giving feedback, which would be ideal, then there are ways that you can do it that will still give you useful information that will influence the people that you're supervising. Samantha Bergman, who's at University of North Texas, and Claire St. Peter at West Virginia University, they do a lot of work in this area on procedural fidelity. Justin Hahn recently published a systematic review, I think with both Sam and Claire, that looked at different procedural fidelity, how procedural fidelity is reported in the research literature. And that's really helpful for you to know, because if you are going to the literature and selecting interventions and you're implementing them as they were described in some article, you want to learn about all the characteristics, all of the multiple treatment interference. You want to learn about all of those interferences that might have been affecting the intervention that's described in the study. At the same time, you can learn a lot from what's been reported and these kinds of tutorials or discussion-based articles that people have published on procedural fidelity that give more of the a practical way of doing it. One of the things when at APBA this year that Sam talked about, her and her students, is some of the studies they're doing on comparing more of a trial by trial procedural fidelity check versus an all or nothing, where they basically do a short observation. They observe if the person they're observing gets an error on one of the steps, let's say it's discrete trials, out of any of those trials that are implemented during the observation, it's an X. If they get it correct every time, it's a check. It's kind of a crude count of it. It's a very stringent count, but that way you know where to focus your energy, where to intervene. And even if you can't always provide the retraining, the BST, the any sort of booster supports for people with low procedural fidelity, at first when you start measuring it, it helps you a lot to figure out how to pair technicians with people who are on the job. Okay. The second thing that you need to look at is what are the coaching tactics you're using? The everybody, new BCBAs taking a supervision class where it's OBM light, almost always learn about behavioral skills training, and then they start misusing it all over the place. We probably won't get into how BST is often misused when concept training and other types of training tactics are needed, but it's a big problem. The other thing that's happening is people say they're doing BST and they aren't. They are going through the 4 steps, but they're letting feedback be the catch-all of a lot of errored performance. So instead of going back and doing more models, doing more rehearsal, doing closer in feedback during the rehearsal, they are going through all of the steps. And at the end, the feedback, they're giving where to improve. And then they don't go back and do more rehearsal, or they don't follow up. They don't set a criterion that somebody has to meet. So if you're using BST, you really have to revisit how you're doing it, because BST is often the first stop that I've seen organizations use before they put someone on a PIP. And that makes almost no sense, because they're not actually doing anything better than had that performer just continued performing what they were doing on the job without any of that feedback. Okay. So you really have to look at how BST is being implemented. And if you are going to use this as a strategy to improve someone's procedural fidelity, then you really need to make sure that you're actually going through those steps. You're using those data to inform what kind of supports and scaffolds you're going to put in. This article by DeGennaro, Reed, and colleagues does go through some of those. It was written for providing classroom teacher support, but it's highly relevant to what you're doing with technicians. And they go through not only the steps of BST, but also some of the support strategies you can use when you are finding that or performers can't do what you're asking of them. Okay. And they provide some examples of procedural fidelity checklists in there. Okay. So consider really stripping down the checklists that you're using. If you're not using them consistently or accurately, strip them down to something that is achievable and focus on that because it's going to make a much better, a bigger difference than doing procedural fidelity checks infrequently or without good integrity in terms of how those data are being collected, how they're being reviewed, how they are being decided upon to provide supplemental training and performance supports as follow-up. Okay. And then you need to focus on the unit of instruction that's going to make the most difference. A lot of integrity kinds of procedures that people put in place are very complex. There are items for implementing a single discrete trial that have like 12 components to them. Okay. And if you don't have a data collector that's skilled enough to collect those data, it's not really offering a whole lot of useful information. So if you aren't familiar with the Learn unit, which was first described by Greer and colleagues, and in this article, Ross and colleagues describe the use of the Learn unit and a measure that they have used in the COBIS model for decades, the TPRA. I encourage you to look at this because it's going to simplify really looking at a technician's performance when they're teaching. Okay. And the structure of the Learn unit, we don't have time to talk through the Learn unit, but this article overviews it. The Learn unit is essentially this unit of instruction. What we call his original paper was the fundamental unit of pedagogy or something to that effect. And what's meant there is if we can focus on this unit of instruction where the instructor and the learner's contingencies are interlocking with one another. My behavior affects the learner's behavior affects my behavior. And then we can pair types of performance improvement tactics alongside of those data. We get much closer to improving procedural fidelity for a technician who's struggling. So this is a stripped down view of what I really like about measuring learn units and using the TPRA is that it's really streamlined and different kinds of performance problems that come up with staff, there are different instructional tactics you can use to improve performance. Okay. And those are described in the Greer 2002 book, Designing Teaching Strategies. These are oldies but goodies. Okay. These are things that a lot of people have not contacted this in their behavior analytic training. And it's really unfortunate because it's where we started getting some drift into more kind of obscure types of tools and strategies when there is something to be said about the simplicity of implementing this and using data that gives you this 360 loop of feedback that can influence your training. Another thing you can do with early new hires who are going in and doing clinical observations is tell them what they should be looking for. Like if you're going to have them go and observe a teaching session, maybe you're only having them look at reinforcer delivery. How many reinforcers were delivered? What was the timeliness of that delivery? What did you notice about the learner's affect, their level of engagement? Okay. You can't have them go in and observe everything at once, even though everything is going on at once. So this table is here's what you should be looking for. If you're going to ask the technician you're observing questions, here are the types of questions you want to ask. What's the program? What's the name of this program? How did you know what to do when they made an error? Is that different from other programs they implement? What should they be recording? Are they collecting data on their own? What kinds of questions about the protocol should they be asking? This can be a way that you have, let's say, 4 or 5 structured observations set up, and each of them have a different table associated with them. These are the things I really need you to look at. Here are the things I want you to ask. And this is a way that when you are limited on who you compare people with for observations, you can really anchor what they need to do in that observation with the person they're going to observe. So then you have a little more structure around what they're going to come out with, and then it makes the debrief easier, which is the last piece of this. A big area that we need to focus on as a field is including structured debriefs after clinical observations. and clinical situations. That might be you're going in and doing an overlap with someone, you're collecting IOA data. We need to debrief about that. You've implemented a teaching session. We need to debrief about that. You were just in a crisis situation with some really high frequency SIB. We need to debrief about that. Okay. Behavior analysts are really bad about debriefing. Sometimes it's kind of the plus delta debrief where we just got a couple of minutes. Let's talk about what went well. Let's talk about what didn't go well and move on our way. Rather than a structured debrief that really walks the learner, especially early trainees, through the experience that they had. What was their reaction to what they observed or just did? How do we describe and clarify what was to go on in that situation or what went on in that situation? How do we analyze those variables? And then we have some takeaways from that. There are a lot of debriefing is not, we do not need to reinvent the wheel on debriefing. There are hundreds of debriefing models out there. They are mostly in the area of healthcare simulation, a lot in nursing. Nurses are great about doing structured debrief. I'm showing on screen a tool, a very popular debriefing method called Pearls. They have a website. They have all their tools are download. They're free. You can watch YouTube videos of people implementing Pearls, but it's a structured way for a facilitator. Like if I'm a trainer and I've got 5 trainees and they've gone out and done clinical observations, it's a way I can structure that debrief with them so that I can make sure that they're attending the right features. I can be responsive to them. I can make sure that the next observation they go on, maybe I fine tune it a little bit. Maybe I select someone different for them to observe. Maybe I select a different time of day or a different client, all of those types of factors. And it just closes the loop. You have this whole closed loop on, I'm going to set you up and I have these expectations. You're going to go and do the thing. And then we're going to come back and there's going to be feedback. And there's not only going to be feedback, there's going to be discussion. I think what has happened with some of the feedback literature in behavior analysis is that a lot of people are talking only solely about feedback. Okay. That is one tactic. Okay. And usually it gets separated from the context of the situation in which you're giving feedback. Okay. So all these, everybody's running around, where I'm afraid to give feedback or I'm going to give feedback. Okay. And not thinking about adding the context in there, not wrapping it together into the whole learner journey. Okay. So I really encourage you to look at Pearls. There are some other ones, I think in the resource list I provide, there are some other ones. Debriefing for meaningful learning is another helpful strategy when you're working with new hires. And it is a good way if you're a trainer and you start implementing, or a training designer or a clinical director, you start implementing debriefs. That when you talk about when should I go observe trainers deliver training? Go observe debriefs. Debriefs are so informative about what's happening out there in the field that you don't know about. Okay. You think things are going well, or you think you know where the problems are. Just have a bunch of new hires do a debrief and tell you their reactions, tell you what they observed. You'll learn a lot more than you will going out there and just walking through to check everybody's safe and still in their respective areas within the clinic. Okay. So really spend some time thinking about that. It is anchored to that issue of procedural fidelity, but it's much bigger than that. Okay. It's anchored back to making sure that that experience is one that's going to really invite people into the field. Okay. So I know that in the last hour, I only made it through 2 of these, so we'll have to do a part 2 because the rest are a whole lot of fun too. But what I'm going to give you at the end, there's this QR code, and this QR code goes to a Google Doc that does it lists all of the pitfalls that were going to be outlined in this presentation, and then gives you resource links. So I've tried to where I've been able to get the articles. I've included the articles or some of the references in there. So I encourage you to go through those and look at them. I suggest you take one of these things. Take on one of these things if you do a journal club regularly, if you have monthly meetings with BCBAs, take one of those. Take the BST article, for example. Take the article on concept instruction and use it to begin the conversation within your organization. We are working, especially as organizations are making that shift to 3.0, because a lot of you are starting to move into getting ready for January 2026. We're offering a discounted brief discovery project. Maddie put in the chat a link to a form where you can schedule time with me. We're doing free 30-minute consults, learning consults, where we'll get on Zoom, we'll chat through your program, look at areas where you maybe have some questions. What would you like to improve on? Where do you need to address some compliance issues? and then see if our discovery project is our discovery engagement is useful for you, as well as if you're trying to make a shift or you're trying to upgrade to your 3.0 asynchronous modules. We have those, and we don't. What we've done is we have been very flexible with clients to splice and dice modules and integrate them with instructor-led training and clinical observations and all those in situ experiences, so that what you aren't having is 40 hours of asynchronous training plus ILTs and all these other events. So we help you figure out that journey, even when you only want to use a handful of our asynchronous modules. The other thing that's happening, not just the 3.0 requirement, is the continuing education requirement for technicians. And if you aren't sure about how to, everything I talked about today, that applies to that as well. You need to get out there and really think about the experience you're building and what are those 12 continuing education hours going to be? What are they, not just exposure to content? It's a very different story to provide continuing ed to BCBAs who have way more training and experience than technicians who have many fewer training experiences. So you can't just throw out there a bunch of 1 hour webinars or 1 hour one-off events and expect that it's going to have any impact on performance. Okay, that's not the way that learning works. So really want to make sure that you've got something in place that's very targeted and focused, and you have your whole clinical team, you've got your whole organization wrapped around it. So we've developed a product, ProTech. It provides these short doses of information, provides short lessons related to some high yield areas that we see people struggle with. And then you can use that to anchor into your supervision. You can use our Protect 15-minute lesson on this error correction procedure and use that to begin conversations in supervision. Look at the way that you're doing procedural fidelity related to error correction. Look at clinical opportunities. Look at supervision and feedback sessions. Okay. So we would love to talk to you about that product as well. I'll give my email at the end. Feel free to reach out. Happy to demo it for you. And then I showed this in our last webinar, but we recently partnered with our friends at ABA Compliance Solution, Rose Fedek and Michael Fabrizio. They're two veteran, 25, 30 years as board certified behavior analysts and working in autism and developmental disabilities. They have run their own practices. And then later in their career, they became these really savvy compliance people. And they're starting the ABA Compliance Podcast. I think it's going to be rich with resources, especially if you're a small, mid-sized company and you don't have a compliance officer responsible for compliance. And we're talking about like billing compliance, not just training compliance. But they have a podcast, and it's going to be hosted under our Operant Innovations umbrella at ABA Tech. So we really hope that we'll be sending out a newsletter that'll be in there. But make sure you look out for that. They also have some great resources on their website. They have a cool tool that they shared with us last webinar that is focused on, it's a checklist you can go through to see how compliant your training program is. All right. So one more time, I'm going to flash that QR code up on the screen so that if you want to take a clip of that, we can also get you the link to that. And there's my email as well as our info at email if you want to chat about your training program. Thank you so much for being here. Again, we'd love to hear from you, especially if you'd like a part 2 to continue going through those common pitfalls and some of the solutions around them. And again, click on that form Maddie's giving you, and we will happily do it'll go right to my Calendly so you can set up a 30-minute free learning consult with us at your convenience. And we hope that all of you we're able to take something away from this, even if it begins having conversations across departments. Even if what you do is go have a conversation with your HR specialist about onboarding and gathering insights from recruitment, that's a big start. That can really influence the training programs you develop. So thanks so much for being here. Again, click that link in the chat and look out for our next webinar in July, August, and through the rest of the year. All right. Thanks for being here, everybody.